live. I wouldn't be showing my face for long, and because of course I desire to teach this moment and ensure we are following up. So I'll be turning off my camera, but I'll be speaking all through. So please follow along. Thank you very much. You're welcome to this channel. And this channel, all we do is to share health and preventive tips that can help us promote our health and prevent diseases. So straight ahead, I'll just get into the topic for today. And it's a very interesting one. I know you will learn a lot. Thank you, thank you, thank you. So we are still on it. Let me switch. I just want to be sure that you are connected and you are following me. If you're on, say hi. Just say hi. Let me know you are on the live. Okay. Okay, so if you are joining, you're welcome to this live session. You're welcome. Okay, this live, I'm so sorry. I'm still trying to connect certain things. Please, pardon me. I thought otherwise, but I don't know. But then I'll be fine. Let me just find a way around it. I have my script stocked up and kind of going through it. So my good Lord. Pardon me, I'm working on something to get my script ready. Okay, I always have these problems. My live stream. This shouldn't be happening again. I'm looking kind of stuck. I can't see the profile. I don't know if I'm the only one having it or is it my device causing it. I can't see comment section. I can't see comment section anymore. God help me. And I needed the comment section to know those I'm interacting with. Okay, so I don't know. I'm kind of stuck. It happens to me whenever I have a stop this life. I'll go on. Thank you for joining. Thank you everyone. I was having a serious network glitch on this live channel. But as it stands now, I can't see comments and it's a concern to me. So because of that, I may have to end this live session and start again. Please. Thank you. Can you go end it? Oh, God help me. No, I keep having these struggles. Sorry for all that went happened. Seriously, it was a struggle. I wasn't seeing all these interfaces and I could not go on like that because it would not help. It would not help the conversation to move smoothly. I think I enjoy having, seeing our chats and responding to it. Okay, so let's go. Okay, are we there? Okay, so straight into the topic. You're welcome. Sorry for the glitches that happened. So today I will be discussing on common cancers that affect men and women and their early warning signs. I went visiting someone and the emphasis on was, okay, what can I do? How do I tell it as a sign? Because we've discovered that when cancers are discovered early, you can, it can help you do more things like preventive things to protect you from further damage and further struggles. So I don't know, but my light is a bit poor and I would be turning off my camera so that I can focus. I don't want to feel tense in any way, but you can flow with me. You can respond on the chat as we flow. Thank you. Okay, so while on it, I really didn't want to feel tensed in today's life. I'm learning I don't know, but if you're with me, if you're having any challenge hearing me, you can reach out to me. Just send a message, I'll respond. This is for education, health education, not for diagnosis. So feel free to share this live as we go on. So I'll be beginning with the first question. What is prostate cancer and who should care about it? What is prostate cancer and who should care about it? Prostate cancer affects the prostate glands in men. So prostate cancer is more like a masculine disease and is becoming very rampant. As a nurse, I observe it becoming very rampant, especially for men above 40 years. So usually 40 years above, especially with age and family history. So if you have cases of people who had these struggles, you need to put it in check. So it is common among African men, and sometimes it's very silent in its stages. So prostate cancer is common among African men. That's if you are an African, you need to also pay tight attention as we go on. So now, but early detection, early responses. Thank you for the likes. Thank you for joining this live. Early detection and early responses help a long way. So you'll be wondering why of all topics, I decided to raise this. It's becoming a growing concern in the medical world. Prostate cancer cases are becoming a growing concern because it's rising over time, and we need to, be able to curb it the best we can. So what are symptoms you should never ignore? You may feel, well, I'm not a male, but you may have a brother, an uncle, a father. So learning from this can help you advise them for better health. The aim of this whole live session is to exchange knowledge that helps us, better ourselves and also helps us achieve better. So don't mind my camera is turned off. I decided not to be tense. I don't know. I notice I feel tense over camera. I'm trying to get used to live sessions, but you can follow along as I speak. If you have any challenge hearing me, you can just type and I will respond. So what are the warning signs that should never be ignored? Number one, difficulty urinating. If you are a man and you find it difficult to urinate, please don't take it for granted. It's a warning sign. We are discussing today prostate cancer, and it is very common, especially for men, African men above 40 years. So then next, if you have a weak urine stream, you try to urinate and it's like dribbling, it's not really flowing despite all efforts, then it's a sign that should be watched. Then we have frequent night urination. You are always urinating very often at night. It's a sign that should be watched out for. Then we also have blood in urine or semen can also be a sign too. When you have blood in your urine or your semen, it's a sign. Low back or pelvic pain, it's a late sign. When you begin to have a low back or pelvic pain, you know that this is a late sign. I'll go over the symptoms once again. If a male around you is having difficulty urinating, is having a weak urine stream, is having frequent night urinating, he has to get up very often, 2, 3, 4 times at night to urinate, and is having blood in the urine or the semen, and in addition lower back pain or pelvic pain, although this is a late sign of prostate cancer. So can prostate cancer be prevented? That's one of the questions that is on the heart of some persons who reach out to me as a nurse. They say, what can I do, nurse? Can prostate cancer be prevented? First, I can tell you that prostate cancer truly can be prevented by doing first healthy diets. You eat less of red meats and more of vegetables. Red meats like cow meats, meat from cows are red meats, and so on. And then eat more of vegetables. So diet changes go a long way Then regular exercise. Most of us are very sedentary. You just wake up from your bed to your chair to your car to your seat in the office and you hardly exercise yourself. That is not effective for your health. Then we have regular exercise. Yes, then you do a check. There's a test they call blood and prostate specific antigen test. So they'll take your blood and check the red reading, because these prostate cells, they release certain hormones in the blood. So for the male, we go to the lab and they take your blood sample and do this test, and this test helps to tell how much the cells are growing. All these cancer cases are cells that multiply so quickly. So we are discussing prostate cancer, so that's why you have to do this prostate specific antigen blood test. So if you are a man over 40 listening to me, this message is for you. If you have not done this test before, please visit a healthcare, see your healthcare provider and request to do this test. Prostate cancer, like I introduced earlier, it is very rampant now. It's a common case that is affecting men over 40 and especially African men. So prostate cancer should be checked. Then when you do this test, it also helps to prevent. So remember, healthy diet, less of red meat, more of vegetables, and then regular exercises. If you are a man, like I said, over 40, please take this message seriously. So I'll be moving to the next session, but I don't know. I'll be dropping a sorry for the noise interference from my environment. So sorry, please. So sorry for the break. I had to really work on that so that the interference will not affect the live stream. So sorry for the break. I don't know if you have questions from what I've discussed so far. I have done the first session on prostate cancer, the warning signs that you should never take for granted, and also I'd also talked on the ways to preventive method. Of course, we know there's an adage that says prevention is better than cure. Prevention is better than cure. So I don't know, I'm not feeling this life. I don't know if it's also resonates with you. So I really want to set up my lights so that we can see ourselves. At least it's good you see who is teaching you, right? To me, learning goes smoothly that way. So I'll be dropping a poll very shortly. I'll be dropping a poll so we can attempt it. I would like to I like to see that we engage it. Okay, so let me try. I'm just test running something. I got to know that I could do a poll here. Okay, let me try it out. So have you ever done a cancer screening before? Okay, so I need your responses. It goes a long way. So let's drop our responses to this poll. Have you ever done a cancer screening before? Have you ever done a cancer screening before? God, I don't know. Whenever I want to start a life, Don't know where sweat just begins to take over. Thank you for joining the live. I really appreciate your presence. I'm trying to set up so that I can do a proper video. Okay. Okay. Yeah. My light is on now, so I can show my vid face. Okay, hold on. Let me set up my head. Okay. My hair is a bit shabby. Okay, so have you ever done a cancer screening before? Most people, whenever you talk about cancer, they like, God forbid, it's not my portion in the name of Jesus. Well, it's still good that I'm not against that, but yeah, I need your responses to the poll. Can you see the poll, please? Tap on it, respond to it. Thank you very much. Yeah, okay, I see some responses saying no, they've never had a cancer screening before. Well, we are getting somewhere today. We are getting somewhere. Thank you for joining this live. I've just only seen one vote, but I believe others are joining. I believe we are joining. Okay. Okay, so I'll be moving on to the next section. I took this break so that we could interact. Now, if you've never done a cancer screen before, well, especially this prostate cancer, if you are over 40, please take it serious. Visit the hospital. Prevention is better than cure. Okay, next I will be going over to this stuff cannot go down. Okay, so I'll be going to the next session on breast cancer. Now, one of the time I was doing research and it was like, can breast cancer affect men? If you feel it's a yes, say type in the comment section. Can breast cancer affect men? Do you think it can affect men? Because somehow it looks like it's only women that have breasts. But the truth is, it's not only women that have breasts too. If you look at the anatomy, men too do have breasts. And some of them, their breasts are even protruding. Some of them that are a bit bulky, their breasts are protruding. So men too also have breasts. So you're welcome to this session. So the next is breast cancer only a women's disease? No. Men can have it too, though it is more common in women. But men can also have breast cancer. So today, take note of this. Take this home. So what changes should raise a concern? What changes in the body should raise a concern? And whatever I'll be sharing today, it's necessary for you to, respond to it and take it seriously. Like for the male, I said change diet changes and rest. But this one, now, I'll be teaching on a breast self-examination method. So what changes should raise a concern? First, if you have a lump, you can feel it, like you palpate it and you can feel a lump in your breast. That lump may not be painful. So that is not painful does not mean you should neglect it. No, that lump should be taken with serious concern. So a lump in the breast, then change in the breast size or shape. Maybe the breast shape changes. You should not neglect that too. Then nipple discharge. Maybe from the nipple there's a discharge, or the nipple bends inside. Instead of being normal, the way it is normally, it now bends inside, or it starts bringing out. You are not breastfeeding, you are seeing something coming out of your breast. It's a sign. Then you have skin dimpling or redness around the breast area. You have that redness, skin dimpling. Please take note of that. So these are tell signs of breast cancer. The truth is, our body always comes up, shows us signs, but we should never take them for granted. Okay, what saves life most in breast cancer? what saves lives. You're joining, you're welcome. We are discussing about cancer, and in this session we've treated the earlier prostate cancer, and now we are looking into breast cancer. So what saves lives the most in cancer? We have early detection, monthly breast self-examination, clinical breast examination. There's what they call mammogram. As you get older, let me also put it for women 42, just the same way with prostate, what they call mammogram. You go to the hospital and speak with your health provider that you would love to do a mammogram, and then they will prepare you, book you up for a mammogram, and then it is done. So that's on that side. And then next is that is where you have the clinical breast examination. So, but many people would say, I don't have the money. But, well, if you don't have the money, monthly breast self-examination is free. Like, you can do that free of charge. You don't need to spend any money. So I will encourage you, as a female out there, you don't need to wait till you are older, because breast cancer affects even very young ladies, especially ladies in their puberty, young adolescents, and the rest. It can affect them too. It can affect all ages. So breast self-examination is key. When you palpate around your breast and you can feel a lump, please visit and see your health provider, make their complaints, and they will do further investigations on it. If you notice any changes in the skin around your breast, please don't take it for granted. Go and do a proper check. Know your normal so you can notice the abnormal. So if you know how your breast normally is, and then you notice it is easier for you to be able to notice an abnormal changes. And when you notice that abnormal changes, it will help you to know, okay, I need to see the doctor, I need to go for further checks. Most times, some lumps may not be cancer, but if you go quickly, they will remove the lumps and you're fine. You won't have to be bothered about the lumps. The lumps wouldn't also have to make your life uncomfortable. Yes, you may not have pains, but it can make you feel somewhat uncomfortable. So thank you very much. If you are joining this live, you're welcome. We are discussing on breast cancer, and I'll be dropping a poll shortly. I want our responses to the poll. Okay, as I drop the second poll, I'm really enjoying this poll stuff. I usually like working with poll when I'm teaching. Which breast describes you today? Just myself, learning for myself. Certain knowledge you get today may not be just for you. It may help you speak to someone that you love, and it can help to save lives. So never take for granted an opportunity to learn. I created this channel to share, as a nurse, to share counsels that can help us, help us live better and longer. So now, what best describes you today? Are you just yourself, learning for yourself, for family, for work, whatever? I'm expecting our responses. I'm using that for a break. Okay, are you still there? If you are there, please give this live a like. Give it a like. Thank you so much. So we are still, can you see my, if you can see my votes? Okay, I can't see any response to the poll. Oh, I don't know why it is so. Am I still live? God, please help me today. I think I'm still live. Oh. The last poll didn't reflect, right? Because I didn't see any response to it. Okay. Sorry. Okay. Are you still there with me? I started having this sneezing, but I'll be better off to. You're welcome. You're welcome. I dropped a poll. That was what I was waiting for response. But I don't know. Okay. Okay. Next, let me drop another and see if it is a glitch or something. Do you this is specifically for, it's related to the first topic I first treated when I started the live. So if you are joining, just follow along. Okay, can you see this poll? Actually set up in a way that I should be able to see it myself. But I can't even see it, so that's why I'm wondering if you're seeing it on the other end, because I'm not really getting responses. So if you can see the poll, please respond. I'm trying to get this because most of these features you can't use them except you are live. Okay, I think I forgot to start poll. Okay, I've learned that one now. Thank you for joining. Okay, no. Okay, so we move. Any other responses? Okay, I'll leave that poll for like 5 minutes before I move to the next one. Okay, so we are moving to the next section nevertheless. Okay, I think I have another poll to put, but I don't know if I can put another poll. I can't know. Okay, it's not going. I have to end this one, then start another one. Okay, this question now relates. Let me test you if you understand. If at all this life is teaching me how to use, because I tried even learning through videos, watching other people's videos, but I wasn't getting it. So now I'm doing hands-on. Just follow me. So I'm about dropping another poll. It's a test of knowledge, so please try. When exactly is this check very, very paramount? I just said it some few hours ago, but I say hours, some few minutes ago, sorry. So, but if you don't know the answer, just type I don't know. I just want to know how well the poll is going. Okay, if you can see my poll, respond. Thank you. Okay, mama. Thank you for joining this live. Thank you. I'm setting up polls and responses. At what age should men start prostate screening? Down. I need your responses. Please, can you hear any sound? If you can hear any sound, let me know, because I'm trying to, if any sound really enters your live stream and the YouTube app picks it, they can flag the live, and I don't want that because of just randoms around the environment. So, yeah. If you are on, please respond. At what age should men start prostate screening? Most especially when you have it in your history. At what age? Can you respond? Thank you for joining this live. Thank you. Okay, I'm about closing this poll. Just one more minute left. Please join. Are you there? I explained the signs and symptoms of prostate cancer earlier, and I want to point it out once again, that if you are having frequent urination, please check that. If you are especially at night, frequent urination at night, maybe you are struggling to urinate to difficulty, you should also check that. So, well, let me give the answer to this poll so that we can move on. At 40 years and above, men should start prostate screening. 40 years, because from research as a nurse, I've noticed that it's from that age up that it becomes very severe and affects people's life. So if you are joining, give this a like as we move on. The next poll is just the last topic I just treated. Okay, who can get breast cancer? Is it women only, men only, both men and women? Not sure. Knowledge is power. It helps a lot. So who can get breast cancer? Is it? If you are seeing my poll, please respond. Thank you for joining this live. Who can get breast cancer? Is it men only, women only, both men and women, or you are not sure? Please respond. Okay. We are still on it. I will soon be going to, I have 2 more points to discuss, and then we'll wrap up for today's live. Thank you for joining. Thank you. So, are we still on? Respond to the poll. I'm still waiting for responses. I want to do another poll, but I just give a few minutes before I close this poll and then set for another poll. Who can get breast cancer? Is it women only, men only, both men and women, or you are not sure? Yeah, give this a try. Your health is true wealth. So when you are healthy, it goes a long way. Sorry, please, I don't know if you can hear any noise from the environment. I'm so sorry I had that short break to go and adjust, because I really don't want any sound interfering with the live stream, because it can affect all the whole effort put in. Okay, so the answer to this poll is, who can get breast cancer? The answer is both men and women. Remember, men too have breasts just as women, just that theirs may not be enlarged as much as in developed as much as we have for the women, but Some men, due to weight and due to some hormonal changes, can have breast, and it can happen to both men and women, but more common with women. So I'll be closing this poll now. Then one more poll before we go to the next session, and that poll is I'm trying to make this as interesting as possible, so follow along. Have you ever done a breast self-examination before? Have you ever done it before? Yes. Sorry. No. So have you ever done a breast examination before? If you are a lady out there following this live stream, you're welcome. We've treated prostate cancer earlier, some few minutes earlier, and breast cancer, and I pointed out that the signs and symptoms of breast cancer is a lump. That lump may not be painful, you may not feel pain, but if you notice a lump, please visit the hospital, see your health provider for further check. If you notice any changes in the shape or the skin around the breasts, you know the normal one, and then you see these changes, please visit. That can be a pointer, and the earlier the better. The earlier it saves your life and helps you live longer. So have you ever done a breast cancer examination, self-examination before? Self-examination is as simple as, while you are in your bedroom, you stand before the mirror and just observe, look around your breast, just look at it. Is the nipple, is there discharge around it? Is it entering inward? Is there any changes? Those are self-examination. You can now feel it to see if there are lumps. If you notice any lump, then you can visit the hospital. That lump may be not painful, but still see your doctor for further check. So have you ever done this self-breast examination before? I expect to hear more yes, because I advocate for prevention, because prevention is better than cure. Prevention is better than cure. So we are going further to the next section, and it's a very interesting topic too, and that is cervical cancer. Cervical cancer is strictly for women. I'll be ending this poll now. Cervical cancer is strictly for women because men don't have cervix. What is cervix? Cervix is actually the opening of the womb. Like, you can call it the neck of the womb. You have the neck. So cervix is that neck, that opening of the womb, that whenever they want to give birth to a child, it opens, it dilates, opens wide, and then the baby's head passes through and a baby is born. So the cervix is the opening of the womb. So cervical cancer is becoming very common. When I did a research on it a couple of months ago, I recently discovered some cases around Nigeria where I currently reside, and most of them were discovered late. And cancer can be very disastrous when discovered late. It just looks like a death sentence somewhat, because you have to battle a lot, chemotherapy, radiotherapy, and all sorts with several drugs. So why is cervical cancer one of the most preventable cancers? One, it is because it develops slowly. It can take years before it begins to, even early signs you don't know, 5 years, 10 years, but by the time it has eaten and caused a lot of harm, it can be very bad. And then, what are the causes of this? You can have, it is persistent human papilloma virus infection. Human papilloma virus is becoming rampant too. Most people know about HIV. Human papilloma virus is also very dangerous, and is one of the major causes of cervical cancer. They have several strains of human papilloma virus that can cause this harm. So it is necessary we prevent this. Having multiple sexual partners can be very risky. Then not having unprotected sex with human papilloma virus. Then early sexual activities can expose you. Multiple sexual partners, like I said earlier. Poor screening habits too. So what are the warning signs for cervical cancer? Remember, I pointed out warning signs for prostate, I pointed out for breasts. This warning signs helps you catch it early, because most of them, when they get to the hospital and start complaining, if you check their review, you see that they had the signs for a long time, but they neglected it, and now the cancer has spread and is now more difficult to manage. So what are the warning signs that you should take note? Bleeding after sex. You just had intercourse and you are bleeding, take note of that. Or bleeding between periods. Maybe you had your period on, today is December 24th. Let's say the last time you had your period was on the 15th of December, and then suddenly today, 24th, you started having your period. You know that you have not completed a normal cycle. You just started having blood flow like that. That is a sign you should take note of. That sudden bleeding is dangerous, so take note. Then foul smelling vagina. Your vagina smells like fish. Take note of that. It's really, really terrible, and you should watch that. Then pelvic pain. You start having pains around your pelvic, and this pelvic pain now, by the time it's becoming pelvic pain, it's already bad. It's the late signs already. The cancer is spreading very fast. So please take note. That bleeding is a good spot sign. It's a good spot sign. But more ways to prevent yourself is, if you are above 21 years, and if you are even under 21 years but you started having sexual intercourse, you are at risk. So but 21 years is usually the ideal period. You go for what they call a pap smear test to test for HPV, and then you take the vaccine. There's a vaccine they give you, and that vaccine protects you from this human papilloma virus from getting into you. The way you have vaccine for other disease conditions like measles and the rest, we also have a vaccine now for human papilloma virus. So you take the vaccine, you go to a health center and request that you need it, and then you save sexual practices. You don't have unprotected sex, use a condom. Then screening is an effective way. For preventing cervical cancer. So that said and done, I'll be dropping a poll to know if you are following. Shortly, you'll soon see my poll, and after that, we'll go to the last session of this live. I intended treating 4 topics. So I've treated prostate cancer, ovarian cancer, and I've treated prostate cancer, breast cancer, cervical cancer, and the last but not the least will be ovarian cancer. But before then, let's answer these polls. Yeah, I'm really happy having that I have to share a poll. I usually enjoy the poll feature, especially on groups, some groups. I'm happy it's on. Thanks to YouTube for setting up this poll session. I really appreciate it. Okay. Have you heard of pap smear before? Yes, no. I'll try colors next time. So have you heard of pap smear before? Please respond to this poll. Thank you for joining this live session. Have you heard of pap smear before? Pap smear, that word pap smear, have you heard of it before? Yes or no? It's possible you may have heard it earlier. I spoke about it. So respond. Remember, I mentioned that pap smear is a kind of laboratory test that is done to check for cervical cancer. They take the mucus around the cervix, and that is the pap now. They refer to the mucus, and then they take it and then put it under examination to check if there are abnormal cell growths. Those abnormal cell growths are pointed to cervical cancer. The earlier it is detected, it can be treated and you will be free, cancer free. But imagine if it is not detected early, it will just spread through the reproductive systems and the rest. We've had some cases where the solution was total, like removal of the reproductive system, and you really don't want that, right? You really don't want that. So I appreciate you joining this live. I just did this poll. I'm expecting our responses. Let me give like 1 minute for response. Have you ever heard of pap smear before? Have you done it too? Have you heard of pap smear? Some persons feel it's not necessary, but like I said, from 21 years and above, it's advisable that you go to the hospital and request for it. It's not commonly done, but there are certain places where they carry out this test and it is effective. Thank you for joining this live. Please respond to this poll if you can see it. Have you heard of pap smear? We are discussing on cervical cancer. Thank you. Are you there? Okay, I'm about rounding up this poll so that we can round up for today. Let me send the next one is if you see I'm enjoying this poll, it's sweeting me. Okay, cervical cancer. I'll try colors this time. Let me see what it is. Cervical cancer is mostly linked to what? Is it poor hygiene? Spiritual? In Nigeria, especially where I come from, a lot of things are linked to spiritual. My village people, they did this, that and that. But sometimes it's our lifestyle to what we do with our life. I'm not against or speaking against that. It cannot be spiritual anyway, but I have to be very sincere with you. Oh, the colors are interesting. Wow, sure. Okay, let me use blue. I think I like blue colors. Okay, so cervical cancer is mostly linked to what? Like I've explained earlier, what is it mostly linked to? So if you can see the poll, please respond. Cervical cancer is mostly linked to what? Please respond to the poll. Let me know if you are following or if you have a grasp of what we are discussing today. Cervical cancer is mostly linked to what? I talked about human papillomavirus, and human papillomavirus is one of the lead causes of cervical cancer. So I really didn't want to take time, so that's why I quickly answered. Human papillomavirus infection. Okay, so we move on to the last but not the least section for today, which is strictly on ovarian cancer. Ovarian cancer is a very silent one. And of course, it affects female only. Why is ovarian cancer called the silent killer? Ovarian cancer is called the silent killer because symptoms are usually not straightforward and they are easily ignored. So stick with me, because I will be sharing some signals that you should not ignore anymore. You go and let them do a diagnosis. It's better you get to the hospital, they do the diagnosis, investigation and the rest, and they discover that no, it is not so. It is better than to just ignore it and then few years down the line, you are being diagnosed with it, and they now even tell you that it's in stage 5, stage 7. You don't, or stage 3, 4, all those late stage and the rest. You don't want that. So what are the early symptoms that are often missed that makes it a silent killer? First is persistent bloating. Your stomach is always bloated. That is one sign. Feeling full quickly. You have just eaten few spoons of food and you are feeling full. It's a sign. Then lower abdominal discomfort. Your lower abdomen, you're always feeling discomfort around that area. Sometimes you say, I don't even know what I've eaten, or I don't know what. That is a sign too. Frequent urination. You just be going to urinate often like that. It's a sign. Frequent urination. Unexplained weight changes. Either your weight goes up or goes low. You become very lean or you become overly obese. Frequent weight changes, it's a sign too. So please don't ignore this sign. Some people now can see this frequent urination and think, when I'm urinating like this, I hope I don't have sugar problem. They'll check sugar, their blood sugar is normal. Say, But you see, that's why ovarian cancer is tricky. It's a silent killer because it's very tricky. So next we have, sorry, this sound is a bit loud. I really want to check that it's not entering my live stream. Like, give me some few minutes. Sorry, I had to ensure that because it's very necessary that there are no interference in this live stream. Like, I don't need any sound coming to obstruct anything. So who should be more alert? First, who are the people that should be more alert of ovarian cancer? Number one, we have women who have family history, maybe her mom or her grandmom, auntie, like that. If you have a history of ovarian cancer, please, you should be more alert on it, on those changes in the body. And then women with unexplained persistent symptoms, like you have the persistent symptoms in your body, you should check that. If symptoms persist for weeks, like you keep having this persistent bloating or feeling full quickly, like you've not eaten anything but you're feeling full, weeks, not even days, please see a doctor. See a doctor. So quickly, I will drop some questions, Q&A. I want to do this Q&A quickly, and then I'll be expecting some answers from the live session. And also, if you're following, just like, so I want to ask a question. I'm trying to use the ask a question setting. So please follow along. Can cancer be caused by witchcraft? Can cancer be caused by witchcraft? I need answers. Can cancer be caused by witchcraft? Can you see my Q&A? Let me ensure that it's reflected. Can you see it? Hope I've not done something. Can cancer be caused by witchcraft? Are we still on this live? Thank you for joining. Thank you for joining. I sent a question that requests answer. Can cancer be caused by witchcraft? I don't know if you can see it. I'm trying to test run this Q&A session. Okay, I don't know. No, cancer cannot be caused by witchcraft. I don't know if some people do not agree with me. Well, for being a professional as a nurse, I will tell you cancer has its medical causes. Well, we can hold several beliefs on this, but on this live session, I will just leave it that way. Does cancer... Let me try this Q&A again. Maybe I didn't do something right. Let me try it again. I'm about sending the next question. Does a cancer diagnosis mean that? You know, many people carry wonderful views. Answers will appear as chat messages. Okay. But I can't even see the questions. Okay, does a cancer diagnosis mean death? Can you see this, my question and answer? I just want to know. I'm test running these things because most times they don't reflect if you are not on using it live and direct. So that's why I'm trying them out. So can you see it on your screen? Can you see it? This is my question and answer on your screen. Does a cancer diagnosis mean death? I'm using another default screen and I'm really trying my best to find it. I can't see you. But if you can see it, let me know. Just type a yes. No, I don't know why it's not visible. Maybe I'll just learn more about it. You said it's supposed to show, does cancer diagnosis mean death? The answer is no, actually. But the question itself is not reflecting, just like the poll. At least the poll was reflecting, so we could see the poll ourselves. Okay, so let me move on. I'm about wrapping up this session. Request. Then most screenings are quick and tolerable. So screenings are not painful. Let's take note. Can lifestyle really reduce cancer risk? Yes, lifestyle can reduce cancer risk. So let me drop 2 polls before we wrap up for today. And these polls are specifically on these polls. Okay, I think this feature is the only one that did not work out for me this time around. I will learn more about it. Which symptoms sound more serious to you? Is it persistent occasional headache, short sleep, hunger, okay, let me try another color. Wow, these colors are quite interesting. So yes, can we respond to this poll? Which symptom sounds more serious to you as related to ovarian cancer, which we just discussed? I'm really sweating, seriously. Can you see my poll? At least I can see the poll, but I could not see the question and answer. I can see the poll, but I could not see the question and answer. If you can see the poll, please respond. Thank you for joining. Okay, this will be the final. I'm about wrapping up. Cancer awareness is not about fear. It's about knowledge and action. Most people don't even want to check. They don't, because of the fear of cancer, they decided not to bother checking. And that's even more risky and deadly. If one person listening today decides to really listen and take action, it's very important. Sorry for that interruption. Share this message, talk about it, protect your health. Follow this page. Please subscribe to this page, like this image, like this live session. There is a lot I love to share. This channel is basically about promotion and disease prevention. Please Join us next time as we continue to share more health tips about it. You can, if you are even watching on the replay, you are also welcome. Thank you so much.